Hello, I'm Dr. Robert Falcone. I'm the CEO of the Columbus Medical Association and its affiliates. One of those affiliates is the Central Ohio Trauma System. I would like to brief you on where we are with our preparations for what may be a disastrous COVID pandemic coming to our area. First, let me assure you, we are prepared. We as the Central Ohio Trauma System have been working with all of our member organizations that include hospitals, hospital systems, public health, EMS, fire, police, and others to prepare for mass casualty situations. I would also like to emphasize that we have had outstanding leadership and support from our state, county, and city governments. In addition, the Ohio National Guard has been on board for about a week and are helping us with logistics. Our preparations for pandemics goes back over 10 years. We have plans, we have process, we have equipment, and we practice these things on a regular basis. Those plans are updated regularly. We most recently updated our COVID plans in January when it became apparent that we may have a problem brewing. So let me fill you on where we are with those plans. All our hospitals are participating, and they are all in the middle of levels of surge capacity. That is the amount of people they can take in at any given time. Level 1 is pretty straightforward. They have stopped doing elective procedures, elective surgeries, and they have discharged those people that don't need to be in a hospital. Having done that, our hospitals and ICUs are currently half full, so we have room. The next level of preparedness, level 2, which they are all ready to do, is to stand up hospital facilities in places that don't usually do inpatient care. So this might be the operating rooms, the preoperative suites, endoscopy labs, clinics, and so forth. This will roughly double our capacity and is well underway and is ready to be implemented at a moment's notice. The third level of surge is preparing to take care of patients outside the confines of the hospital. We as a community, as the 4 health systems, have come together to organize a facility at the Columbus Convention Center. We are very far down the path of planning and are about ready to implement. We'll get things set up and then open it up within 72 hours notice if we need it. So let me tell you how that's going to look. The Columbus Convention Center, it's huge. It's almost 400,000 square feet on the first floor. We're going to use that first floor exhibit space to create 4 separate areas where the systems will have their own mini hospitals. Each health system will manage their own area and will coordinate through a central administrator. This will probably be a COVID-only hospital, and it'll be a hospital that looks more like a field hospital than the hospital you're used to seeing. Remember, if we get to the point where we need to stand this up, it's disaster medicine, not the medicine you're used to. The patients that are going there are patients that don't necessarily need a hospital but aren't well enough to go home. So they will either come from a hospital or from an emergency department. We will not take squad runs and we will not take people off the street. You have to go through a hospital. These 3 levels of preparation, we believe, will adequately meet the surge that is predicted for Ohio, and especially for Central Ohio and our region. Do we have any concerns? Absolutely. There are a lot of moving parts and we need to make sure they mesh, and we are. We are always concerned about the need for people and equipment, and we are working those plans to make sure that they are available. So I'll leave you with this. We are in good shape as a community. We'll get through this, and we'll make sure you get good care for you and your families. Thank you.